Thank you for the opportunity to speak at SWOC. My name is Tarassoli, and this is our study on the proposal of a surrogate marker for posterior tibial slope measurement on rotated lateral knee radiographs following total knee arthroplasty. So despite advances in component design throughout the years, dissatisfaction following total knee arthroplasty remains quite high, and although this is multifactorial in nature, we know that posterior tibial slope has an influence on several factors which can lead to poorer patient outcomes. Measurement of the posterior tibial slope can be challenging on rotated lateral knee radiographs, such as the image that you see on the left. As you can see on the right, it's quite easy to determine the blown plate interface, but on the left, this is virtually impossible. So how big a problem is this? Well, we conducted an audit of our lateral radiographs with regards to true lateral parameters, and we found that there was about 20-25% of our post-operative total knee replacements which had inadequate films and 15% in trauma. And bear in mind, these were films which were not rejected following QA by the radiographers. So the solution, we propose the use of a surrogate marker for measurement of the posterior tibial slope. This would be the stem of the tibial component, which has a fixed orthogonal relationship with the base plate and is therefore unaffected by coronal or axial plane rotation when taking measurements. So the aim of the study were to validate the tibial stem as a surrogate marker for the posterior tibial slope measurement in true lateral radiographs and apply its use as a surrogate marker again in those rotated lateral knee radiographs. We collected data prospectively between August 2019 and May 2020 and identified 57 patients who undergone total knee replacement during that time. Now, all radiographs were scrutinized for the true lateral parameters within 3 weeks of their discharge, or effectively when they had their X-ray, which formed two groups. Group A, which had true lateral postoperative radiographs, which were 43 patients, and Group B, who had rotated or inadequate radiographs, which were 14 patients. These then had repeat true lateral radiographs obtained at 6-week follow-up, which formed a cohort of 10 patients due to loss to follow-up because of COVID. To validate the tibial stem as a surrogate marker, we compared measurements taken using the base plate, which is a standard technique, to the measurements taken using the stem with 3 observers and using a fixed reference frame, which is the posterior cortical line of the PCL within PACS. These measurements were taken independently for each measurement of PTS for the stem and base plate by each observer. The technique which is demonstrated here. For validation in Group B, we compared measurements taken using different X-rays on the same patient. That's the rotated X-ray and the true lateral using the stem in the rotated X-ray and the base plate in the true lateral for measurements of the posterior tibial slope. Our primary aim was to measure agreement, and we used the intra-class correlation coefficient for this, with good intra-observer reliability. In Group A, our results showed near perfect agreement for all 3 observers when measuring the posterior tibial slope on the same radiograph, comparing the plate and the stem. And similarly in Group B, when the rotated and the true lateral radiographs were compared for measurements of the posterior tibial slope using the stem as a surrogate marker and the base plate on the true lateral, with similar results for all 3 observers. Our results strongly support agreement for all 3 observers in both groups, and therefore we've been able to validate the stem as a surrogate marker and apply its use in rotated lateral radiographs. The limitations of our study are that we only investigated one type of prosthesis design, and additionally there was some inter-observer variability in measurements of the posterior tibial slope, although this is in keeping with similar studies in the literature. Furthermore, we didn't conduct an a priori power calculation, but our narrow confidence intervals in our ICC values do support a low likelihood of a type 2 error. Strengths of our study are that we minimize bias with our sampling method, blinding observations, and maintaining a fixed reference frame. And furthermore, this is a simple method which can be used in all lateral radiographs and can be of particular use in those with the presence of subtle rotational errors. So in conclusion, we've identified a surrogate marker for measurement of the posterior tibial slope in postoperative total knee radiographs and validated its use in rotated lateral radiographs. This is a method that can be applied to measurement of the posterior tibial slope in all postoperative radiographs of this prosthesis, or in fact any others where the angle between the tibial base plate and the stem is known.